Welcome to Old Guy Talks to Me, a podcast dedicated to helping guys create kick-ass lives for themselves and those that they love. Ladies, if you want to know what your guy is thinking, this podcast is for women too. Each week, a special guest helps you create that life you've imagined. We talk anti-aging medicine, personal growth, relationships and hot sex. Yeah, you hear me, getting laid more frequently, other guy vices, and topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Don't want to miss anything? Be sure to subscribe, share, rate, and review this podcast. And be sure to go to www.thestandard.academy/magazine and grab a free copy of our new digital magazine, The Standard Academy, where we talk about erogenous zones, growing hair back, and other things that will help you create that kick-ass life. Now get ready to listen up and share with friends.
Korth, the official old guy of oldguytalkstome.com, a podcast dedicated to helping guys create kick-ass lives for themselves and those that they love. And part of that kick-ass life sometimes has to do with, well, dealing with injuries from working out, or maybe dealing with injuries from sitting around too much. But there's a whole bunch of stuff in the regenerative medicine that we want to talk about. We talked about some of it on other podcasts, and we have Dr. Buzz Korth, and he's the founder of the Buckeye Physical Medicine and Rehabilitation and Optimum Anti-Aging and Aesthetics. And these facilities specialize in non-narcotic pain relief combined with anti-aging therapies, bioidentical hormones, peptide therapies, birth tissue allografts, and medical weight loss programs. They are also one of the country's most experienced regenerative medicine practices with over 10,000 procedures performed. And he's a double board certified in non-surgical decompression therapy, board certified in anti-aging medicine, and he's also earned 2 fellowships, one in stem cells and the second in functional medicine. And he's the CEO of Comprehensive Biosciences and Regenerative Kits. And he frequently talks on the benefits of biological allografts and autologous therapies on podcasts and conferences. And that's what brings him here. I met Buzz at the World Peptide Conference. And that was almost a year and a half ago. And then somehow he found my business card.
Believe it or not, it fell in my car in the no man's zone of my car. And I was cleaning my car. I was like, oh man, I'm supposed to call you back. So here we are.
Here we are. No problem. We're already here. So welcome to the program, Buzz.
Yeah,
so I got to first ask you now, when you get a name like Buzz, everybody's got to go, okay, how the hell did you get a name like Buzz?
No story behind it. I'm sorry. My name is Roy, and my dad's name was Roy also, so they called me Buzz as a kid. I wasn't like Buzz in college or anything, so no good story behind it, unfortunately.
Oh man, you got
to make my grandfather's name or something, and it kind of stuck.
Okay, well, you got to make one up just next time, you know.
So
we were when we were at the meeting, we started talking about one of the things that I had used in my practice a long time ago. Actually, there were no centrifuges then. It was all it was a hospital perfusion machine that we got our PRP from.
No way, that's crazy. Okay.
Yeah, which is about the size. It was about the size of a small washing machine, and
it's a little easier now. It's a little easier.
Yeah. Well, it was a lot easier when I got done. But yeah, my assistant, she would have a nervous breakdown. I said, "Oh, we're going to use PRP in this case because there was all sorts of hoses going all sorts of places, and we were hoping that they were going in the right places." So let's talk a little bit about one of the things that you do a fair amount of is PRP. And why don't you, let's talk about what actually is platelet-rich plasma.
Yeah, great. So platelet-rich plasma, or PRP, is considered autologous, which basically means that you're making it from the person's own blood. So it's not from another person or anything like that. And the procedure itself is fairly simple. The patient would come into the clinic and we would draw blood out of the patient, like a simple blood draw. And then from that blood, we were able to make this product. And the way I try to explain it to patients is, PRP, you grab all the growth factors, which are basically proteins that are in the blood, and you inject it or put it in an area where you want things to heal quicker. Because those proteins are food for your own stem cells, and they help make the area heal much quicker. And as we get older, in particular, we have less stem cells. We don't have as good a circulation in our joints. And you really see the areas we mostly treat are joints. And you might say, well, why do joints break down and muscles don't break down as much? And that's just because as we get older, joints have poor circulation. And stem cells have a hard time functioning when there's no circulation. So we can take a person's blood, we capture these platelets or growth factors, you put them into the area, and it really supercharges healing and helps you heal like a young person again.
Okay. And what type of things do you use platelet-rich plasma for? Just some examples in terms of maybe injuries or therapeutics or things like that. What kind of places do you find it most helpful?
What's really cool about this is you can use it anywhere you want to have things heal quicker or grow better. So, we have a lot of doctors that use it for hair. Now, obviously, if you're bald, you're not going to grow follicles back. But if someone's hair is thinning, you can take get the platelets or these growth factors and inject it into the follicles or inject it into the scalp. And literally, you'll take a follicle that's unhealthy and make it healthy again. So it makes their hair thicker. It's used a lot in cosmetics. So you can have someone who has, they call it vampire facial, the trade name, but you can have someone who wants to have better skin. Well, obviously, if you take these growth factors and you inject it, and the way they do that is they use a microneedling technique, which is a very small needle, and kind of like pepper the face. And then they you literally rub the blood on their own blood back on their face or these platelets, and it makes their skin look better. In our practice, we really focus on orthopedic use. So you'll take somebody, as we get older, you get these nagging injuries, and what I see, and you might see the same thing, Orest, is a lot of people quit working out, not because they don't enjoy working out, but they have too many damn injuries. Mm-hmm. It's not fun to work out if your shoulder hurts, your knee hurts, your feet hurt. You have all these injuries and it becomes unfun. So then they quit working out, and that leads to the cascade of, then if you're not working out, then you put on body weight, you get metabolic syndrome, cardiovascular issue, just because you have all these injuries. Well, you can take a person that has, chronic knee pain or chronic tendonitis in an elbow, inject this PRP into that area, and it basically helps that area to heal like you were young again. Because when you're young, those injuries heal. But as you get older, because we have less stem cells and less growth factors, that get able to get there, we're able to kind of cheat the system and put it right where we want it.
I'm 70, and actually, and I still work out pretty heavy, but I know that there are certain days that I'm a little sore than I am other days. And I've also been very conscious of, like, if it hurts, stop.
Yeah. So, I have two young boys. I have a 16-year-old and a 19-year-old. And, I remember when I was that age, I was a knucklehead. So if I was injured, I trained through the injuries and stuff. And I try to tell them, hey guys, there's no such thing as training through an injury. You can train around it, but you're not going to be able to blast through it, especially as you get older. And working out is a marathon, not a sprint. It's a lifestyle, and it's important for someone to work out, until the even 80s and 90s, because that it makes the tendons stronger, it makes the bones stronger. But unfortunately, you're going to get these, if you're training hard, you're going to have injuries, and you need to do, what can you do in typical medicine? And you probably know this. So if you go to your doctor and you have elbow pain or shoulder pain, the first thing they want to do is dump some corticosteroid or cortisone in there, which is the worst thing.
Yeah. Absolutely. People, I hear that and I'm going, oh my God, don't do that.
If you missed that URL, it's in the show notes. Don't worry, it's right there for you to use. This is Orest from the Standard Academy, a men's lifestyle coaching program. Let me ask you, have you paid a price? Have you paid a price in other areas of your life for your professional success? Yeah, you know what I mean. Are you just in a roommate situation with your wife? Or are you arguing all the time? Certainly there's no sex. And your kids, do they ignore you? Or worse yet, do they disrespect you? Is that your case? Is your life not working out the way you had planned? If so, I'm going to encourage you to revitalize yourself and get on a short activation call with me. That's right. Get on a short call with me. And I will, share with you some things that you can do to bring back that energy into your life. Go to the standard.academy/15-minute activation call and schedule now. That's /15 activation call and schedule that right now. Don't wait. Don't hesitate to procrastinate. This is your opportunity to start the turnaround in your life.
Well, they might not realize it. I mean, think about it. You're only allowed to get 2 of those injections per joint per year. And if you would get 3, it's literally medical malpractice because of the amount of damage they do. Each cortisone injection causes up to 8% bone loss and weakening of the tendons. So anyone listening, if you're getting cortisone shots, you're just fast-tracking surgery. Cortisone does nothing to heal it. It's a strong anti-inflammatory, and you might get some short-term benefit, like a pain reduction, but you're just destroying the joint. Like it makes no sense whatsoever. So, the only time, we do use cortisone in our practice, but it's only if someone says, hey, I'm going to replace my knee anyways. I don't care, but I want to get through the holidays. So can you get me through, the holidays? We'll do a cortisone shot because it might buy them 6 weeks of time, but it's causing more damage. There's no doubt about it. So these procedures like PRP, give you the opportunity to heal like a young person again. That's reality. And I also want to be clear, not all PRP is the same. So, and this is unfortunate because I've had some patients who will come in and say, well, I did PRP and it didn't work. Well, there's a huge difference in the quality of PRP. And it's important, I think, if you're going to see a provider to ask, what type of PRP kit are they using? And I don't want to get too technical here, but I think this is something people could, if you ask your physician this one question here, it's going to tell you their knowledge base. When you do make PRP, there's what they call single spin PRP, and then there's double spin PRP. Okay. Mm-hmm. And basically to kind of keep it really simple, and it also depends on how much blood they're going to draw out of you, because the more blood you take out of the person, obviously the stronger the PRP is going to be. So if I take 20 mLs of blood out of you, or 2 vials of blood out of you, compared to if I take 8 vials out of you, obviously I'm going to get stronger P on the backside if I take 8 vials out. Does that make sense? It's kind of like you make orange juice. I can take 2 oranges and make a gallon of orange juice, or I can take 10 oranges. They're both orange juice, but do they taste different?
Yeah. I know that when I was in practice, there was a between the various companies that produce centrifuges, and they had their own protocol. There was a huge difference in the number of platelets that were actually harvested, and some were almost like negligible. And we were getting an 8 to 10-fold concentration with the particular machine that we were using, and you could actually literally see sometimes the quality of the platelets. Question about, since we're talking about quality, have you found that the age of a person does that make a difference in the quality of their PRP?
Of course. Obviously, as someone gets old, and that's why the quality of the kit really becomes important. Okay, so if you take a single spin kit, that basically means the provider's going to take blood out of you, spin it one time, grab basically, if you could visualize it, like the foam on top, we'll say it would be what they're going to inject back into. That's all the platelets. If you single spin it, the maximum concentration you get would be a 3x concentration, which is basically 3 times the platelets of just regular blood, which really isn't much better than taking blood back out of you and injecting it back into a joint, if you think about it. When you get to the double spinning, it goes to 30x. It's simple math. Mm-hmm. So a good kit with 30x concentration, the magic number we have in this space is you want 9 to 10 billion with a B platelets into the injured area to really get a good effect. Mm-hmm. But the only way you can get there is you're going to need to take 60 mLs of blood, which would basically be 6 test tubes, and double spin it. That's the only way you can get there. So, I know you have a lot of lay people listening to here, and they're like, how am I going to know what to ask? If you just ask the doctor, hey, the PRP system you're using, how much blood are you going to take out of me? And is it a double spin? Then the answer should be 60 mLs of blood at least. And yes, it's double spin. If that's the case, most likely it's a good kit. Now, if they say we're going to take a couple tubes out and put them back into you, that's a provider that's really not an expert in this field. And there's a lot of people out there that do PRP but aren't really experts in it.
Yeah, I think that's really true. And as a patient, I know that when I go in for other areas of my body, it's really hard to figure out, because everyone knows the right thing to say, and everybody's got a really killer website, and they got and everyone's got testimonials and, and everything else. So it's hard to kind of get through and figure out who actually knows what they're doing and who doesn't.
Yeah, unfortunately, but you're able to make, the key thing is ask questions. And if they're not willing to ask questions, you're at the wrong provider.
Well, and I think those two questions that you gave for people to ask are very, very key in terms of really identifying things. I know that I've been in the functional medicine space. Well, actually, not been in it for quite a while, and actually 25 years. I've been on testosterone for 25 years. And way before it became popular.
Before it was cool.
Yeah, I did before it was cool. My primary care physician, told me my balls were going to fall off and I was going to get a heart attack and prostate cancer and everything else. And they're like, I don't know. I don't think so. I don't think that doesn't sound quite right to me. But because I had some friends that are really knowledgeable in this space, and but it was, it's hard to find quality physicians in this space that actually know what they're doing. I know, like, the testosterone thing is, I have friends that ask about it, and I'm going like, dude, what you're getting is not going to help you. And going in and getting a shot every 4 weeks, it's like you're going to
cause more harm. You're better off not doing anything.
Yeah.
What I've seen too, Orest, is as insurance reimbursements are dropping for providers, more and more providers are getting into these cash services, but they don't know what the hell they're doing. So there's a lot of providers that are getting into testosterone therapy. At Buckeye, we have over 1,000 patients currently taking on testosterone therapy, males and females. And as you know, it's the practice of medicine. The more you do, the better you get at it. You can't go to a weekly seminar or buy a franchise and be good at doing hormones. It takes years and years and reps after repetition after repetition. So if someone's going to go, like, hormone replacement therapy is a life changer. You experience it yourself, right?
Thank you for joining Dr. Orest and his incredible guest. Like what you heard and learned? Then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it. 3, leave a review and rate this podcast. Opt in at www.thestandard.academy/magazine and get our free digital magazine with savings, articles, and deeper dives into cool controversy. Be the guy who takes action. Without action, you're not going to get the results you want. Thank you again, and make it a great day.